25 million Nigerians live with sickle cell anemia, while about 25 million others have the trait. There are three genotypes that exist worldwide. An individual is either AA, AS, or SS. AA is the healthiest with no sickle cell anemia trait. AS has a trait of sickle cell anemia, and SS means that the individual has sickle cell anemia. Sickle cell anemia is a common genetic condition that occurs when a child inherits sickle cell genes from both parents. If a person inherits the sickle cell gene from only one parent, the person would have a trait of sickle cell but not the disease. Sickle cell anemia is not contagious and can only be inherited from parents. If both parents have sickle cell traits, there is a 25% chance with each pregnancy of having a child with sickle cell anemia. The knowledge of genotype is important, and intended couples should know their genotype and that of their partner.
I won't advise those who have genotype incompatibility to marry. I know love can be blind sometimes. Don't let love be blind, please. Let love have its two eyes wide open so that you don't go into marriage relationship with one who does not have a compatible genotype with you.
According to the World Health Organization, Nigeria accounts for 75% of infant sickle cell cases in Africa. Nigeria also has the highest number of infants that die of sickle cell in Africa. Reverend Babajide Olowodola, on his 60th birthday, founded the Babajide Olowodola Foundation, which focuses on combating sickle cell anemia.
That foundation came into existence about 3 years ago when I turned 60, and I felt there was need to give something back to society, borrowing from my own personal experience. We've had a wonderful story with our last born who lives with the sickle cell disease, and because of what we had gone through, we thought as long as God gave us strength and breath, no person or no parents should go through what we went through as much as is possible. That was what informed the Babajide Olowodola Foundation.
At the onset of the foundation, Reverend Olowodola, his wife, Pastor Mrs. Comfort Olowodola, and the executive director of the foundation, Ms. Adebola Benjamin, all on a fact-finding mission, attended an annual convention of the Sickle Cell Disease Association of America in Baltimore, Maryland, USA. The convention was an eye-opener and further buttressed the task ahead of the foundation, Nigeria, and Africa in terms of medical advancement in breaking the cycle of sickle cell anemia. The goal of the foundation is to improve the quality of lives of individuals with sickle cell anemia.
What we do is to provide support and care for persons with the sickle cell disease. And I want to use this opportunity to thank all our supporters, all our partners who are ensuring that we give this scourge a run for its money. And God is helping us in our own little way. We're doing that for 3 years, and so much has happened.
According to the World Health Organization, it can be managed by high fluid intake, healthy diet, folic acid supplementation, pain medication, vaccination and antibiotics for the prevention and treatment of infections, and a number of other therapeutic measures. The Babajide Olowodola Foundation, in partnership with other groups, sponsored 12 individuals with sickle cell anemia for a clinical trial at the Nigerian Institute of Pharmaceutical Research, Idu, Abuja. This was a capital-intensive project as their medications, blood work, and hospital bills were fully taken care of. Living with sickle cell is challenging, both for the individual as a person and the individual's family and close friends.
I came to know about this program through the neighbor, Brother Solomon. The part of the program, we enjoyed it so much because they gave us a lot of advice on what to eat and what not to eat, what to wear and how to take care of it. my child Jamilu. Jamilu is fine, is doing fine, is 14 in SS2. Last year, he attempted GC from SS2 and he made it 5 B's and 4 C's. He's a science student.
Mommy Ginger that invited me to this foundation and I came down. So I meet others and I hear advice from them. They are so caring. They were there calling, no harm. Even when I was in labor, they was there for me. They really tried for me.
The foundation is helping me before I travel. So since the death of Joshua, I have not been in Abuja. People is doing well. The foundation, they are helping for his school. He doesn't have crisis any longer. But last year, he was about to have that crisis. When I called mommy, now brought their drugs for me.
This foundation have been benefiting from me. Even when I was sick in the hospital, they are there for me and they are really friendly. I'm benefiting a lot from them.
No parent is allowed to bring to this world any child that will carry the sickle cell disease, where there is proper counseling and instruction.
The Babajide Olowodola Foundation has collaborated with research institutes that focus on newborn screening projects in Nigeria. Here, newborns are screened for sickle cell anemia. The foundation has been earmarked as one of the research centers where the database would be kept. This way, international organizations will be able to easily access data on sickle cell anemia in Nigeria. The Sickle Cell Foundation of Nigeria holds counseling training in Lagos for both nurses and caregivers, and opportunities also abound outside Africa. There is an urgent need to establish a counseling center in Abuja, which will serve the federal capital and northern Nigeria, as the only other one is in Lagos. The foundation will embark on an enlightenment campaign by publishing sickle cell fact sheets and distributing them to schools, primary, secondary, and tertiary, as well as hospitals to reduce the rate of reoccurrence. The foundation will create a small laboratory to process blood samples from outreaches. This will require purchase of blood analysis equipment and an operational vehicle to transport medical personnel to and fro various outreaches. The foundation is working towards creating a sickle cell counseling center. The center will be open to the public for free counseling about sickle cell anemia. There would also be care and counseling for individuals with the condition and their families, with emphasis on the need for a healthy, balanced diet, proper and regular medications, and the need for the individual to avoid stress. In pursuance of the Foundation's mission to provide excellent and improved care of people with sickle cell anemia in Nigeria, it will require strategic partnerships with more international organizations. The Foundation will train its staff and volunteers in order to be able to give good counsel to individuals and parents as to how to manage or prevent the reoccurrence of the condition.
But we still need to do more, and we need a lot of support. And I know that God is going to provide that support for us so that we'll be able to do much more than what we are doing now. We don't want to be a local champion. We don't want to break barriers, we want to break boundaries.
I'm blessed because I'm special. I want to encourage anybody that is anxious that person is actually special and blessed. Don't feel that your word is bad, that God has forsaken you, God has not for you. Be happy and be prayerful. There is nothing that God cannot do. I am a mother of twins. My first baby is twins. So there is nothing that God cannot do.
I like to encourage parents who have had this most amazing experience. It's not a death sentence. I want to encourage you. I want to say that all hope is not lost. The God who has helped us and brought us this far is able also to help you. He's our helper. And if He helped us, my dear friend, He will help you.
Let us join hands as individuals, families, institutions to help those living with sickle cell anemia and lower the rates of the disease in newborns. Support the Babajide Olowodola Foundation today.